Hi, welcome to this week's edition of Comments on Psych Meds by a Psychiatrist. I'm Dr. Ankur Saraya, and today I'm going to talk about stopping medications. So, contrary to what people who are anti-medications will have you believe, psychiatrists are both interested and knowledgeable about helping patients stop medications. It is a complete fabrication to assert that psychiatrists will abandon you if you either need to or just decide to come off of medications. And the other important detail to keep in mind is, just like lots of aspects of this topic area, you got to be careful with general statements that are made describing all medications, all psychiatric medications. So there are some basic general principles, but a fair amount of variation depending both on the medication or medications in question and also your individual situation. So, for example, a general principle that I ascribe to is that if there is no specific reason for urgency, I will generally take patients off any medication gradually. It just seems to make common sense to not make any abrupt changes to somebody's physiology. And even though there are some medications that can very easily and safely be stopped immediately, I will generally taper any medication if we don't have any specific urgency or deadline. That being said, as I alluded to earlier, there are going to be certain situations where you do want or need to stop a medication quickly. Examples of this are if a patient becomes pregnant unexpectedly, or if they are diagnosed with a condition that requires starting another treatment very quickly that may interact with one of their medications. Those are two situations where you may need to stop a medication very quickly. And depending on the medication, most medications that I prescribe as a psychiatrist can actually be stopped relatively quickly and safely. There are a few medications that have any kind of danger being stopped quickly, although there are some, and that's why it's important to do, when you are stopping a medication, to do so with the guidance of your psychiatrist or your prescriber. There's also differences in individual sensitivity to changing doses of medication. So even though a particular medication may not generally be problematic to stop quickly, certain patients are more sensitive or uniquely sensitive to coming off of a medication, and all of these factors need to be taken into account when coming up with a plan to get somebody off of a medication. But again, to summarize, psychiatrists, we are knowledgeable and aware that there are situations where it makes sense to stop a medication, and we are knowledgeable in how to do that and can guide our patients in how to do that. Not all of the same precautions and timetable apply to all medications equally. So it's important to get specific advice on your particular regimen, and certainly to feel comfortable discussing the idea of stopping medication with your doctor. We're used to it and certainly open to it. And I guess I shouldn't generalize. You may encounter certain doctors that may be less helpful than others, but generally speaking, in my experience, it's something that we're all used to doing. And if you do have a doctor who, for some reason, will not give you guidance on how to come off of a medication, go ahead and consult with somebody else, because I think you should be able to find someone who is willing to guide you through that process. Okay, thanks.